right. Well, welcome everyone. On behalf of United Way of Dane County, our Health Community Solutions team, volunteers, and our local partners, I'd like to thank you all for attending this virtual press conference announcing our new health focus strategies. Today, you'll hear from several members of the group who took on the task of researching and creating our new health mobilization plan, which was approved by a board of directors on April 29th, as well as a few of our local nonprofit leaders who are supportive of this strategic evolution. If you have questions as we go, please use the chat feature in Zoom. We will leave time at the end for Q&A. When chatting a question, please list your organization or media affiliate. Now, to get us started, I'm going to hand things off to our President and CEO, Renee Mo.
Thank you, Ashley. And thank you to all of our speakers and attendees today. We're really excited to have you here for this announcement. At United Way of Dane County, we're dedicated to making sure the community can come together to solve our toughest issues. And we know that it's only by coming together that we can make that progress. Today, you're going to meet some of the volunteers and partners who make that work possible. We're dedicated to uniting the community to achieve measurable results and change lives. And through our many relationships with local businesses and nonprofits, we're able to harness the caring power of Dane County to make real change. You'll meet some of the volunteers and partners who make that work possible today. And as we continually evaluate and innovate how to best serve Dane County, we focus our strategies and goals within our community's greatest need areas: education, income, health, and working with families in a two-gen approach to make the most impact possible with donor dollars. As the largest private funder of health and human services in Dane County, and as a nationally recognized change catalyst, United Way's board is committed to elevating racial equity as a core component of our work. We know philanthropy has a unique and powerful role in shaping the well-being of our community and trajectories for our communities of color, either positively by expanding opportunities or adversely by perpetuating racialized disparities. Philanthropy is well positioned to call out these inequities, but is often, by not acknowledging racism, exacerbated the inequities that we exist to address. Given our nation's history and inequitable life outcomes based on race, we believe it is imperative that we incorporate a racial equity lens and bring a commitment to make sure that we are able to create these changes. We've been intentionally focused on uprooting racial disparities for I'm sorry, my page keeps jumping around here, which is why I'm stumbling here. So given our nation's history and equitable life outcomes based on race, we believe it is imperative that we incorporate a racial equity lens and bring a commitment to fairness into our work. We've been intentionally focused on uprooting racial disparities for over 3 decades, starting with naming the racial opportunity gap in education. And we've learned a lot about how to do this work even more effectively over time. Let me acknowledge the discomfort and even disdain for talking about racism and equity. There are not many people I talk with who don't want situational fairness and equal opportunity. Most people want every community member to be successful and contribute to society. Where we get stuck is recognizing that we haven't had situational fairness and doing the hard work to make sure opportunities are not distributed by race. When I was hired into this job, a real estate CEO said to me, "I know United Way focuses in on root causes and gets results, but we need to get to the root causes of the root causes. What is it going to take to finally knock down these embarrassing racial disparities to make sure people can be self-sufficient? This is the work we're doing, and we need the support of the full community to keep going, to embrace the discomfort, and to actually build what most of us desire: a Dane County where everyone can succeed in school, work, and life, a safe and thriving community and economy." Local businesses and individual donors are able to support any nonprofit organization of their choice through the United Way Community Campaign. And with precious, unrestricted dollars for our community's greatest needs, our volunteers invest in evidence-based and community-informed approaches that address root causes and make positive, measurable change, not just at the program level or agency level, but at the community level. Using these unrestricted dollars to focus on issues and community-wide change is what differentiates United Way's work. Our greatest needs focus areas in education, income, health, and 2Gen are the right levers, and the work is ever evolving. As a community, when needs shift and change, as we learn more from data and lived experience, and as we evaluate the local landscape to see what needs to be addressed, and that's why we're here today. For several years, we've been working to increase health access to Dane County community members. Our Health Connect program, in partnership with UW Health and Courts, helps individuals and families with lower incomes pay for their health insurance premiums. Leadership with the Dane County Health Council, partnering with the Black Maternal and Health Child Alliance and EPIC, collaborations with community health charities and American Heart Association, and our 211 helpline, the most comprehensive health and human services database in all of Dane County. It's there to help make accessing resources easier for people 24/7, 365 when they need help or don't know where to go for help. We're very proud of our collective work and the results we've achieved with previous mobilization plans in health. And we continue to evolve forward to make the best use of donor dollars and address the root causes of the root causes through investment in families and nonprofits. Thanks to the hard work of our volunteer community solutions team, our community and nonprofit partners, including those most impacted by health disparities, Staff Director of Health, Gabe Doyle, and our Vision Council and Board of Directors, we have exciting and innovative health priorities to announce today. These strategies will be funded by volunteers with unrestricted dollars raised in this year's community campaign in concert with our education, income, and 2Gen strategies. To tell you more, here is United Way Health Community Solutions Team volunteer and Courts Community Health Liaison Manager, Carla Gaines.
Thank you, Renee, as I get off mute. Thank you and welcome everyone. I've spent many years in this community, the community we call Madison and Dane County. I've raised my family in this community. I've raised 3 children right here in this community. They have gone to schools right here. I go to Mount Zion Baptist Church. We just celebrated 110 years right here in this community. I work at Courts Health Solutions for the past 27 years with our Badger Care Plus members, our most poor, most vulnerable, underserved in our community. This place I call home routinely lists as the best place to be born, play, work, grow, and retire. We also know there are not many, if any, measurable health outcomes that don't show disparity negatively impacting our Black, Latinx, Indigenous, and Southeastern Asian residents of Dane County. I know firsthand what these families that are doing. I understand their issues. With families, I know that trust is critical to building any relationship. Any foundational relationship is built first on trust, especially one as intimate as social service agencies and, like my own courts, our health system. As James Baldwin wrote, not everything is faced can be changed, but nothing can be changed until it is faced. I'm gonna say that one more time. Not everything is faced can be changed, but nothing can be changed until it's faced. And that's what we're trying to do here today. It is time to face this immutable fact. Systemic racism has been a driving force in creating the racial health disparities that remain persistent since America began. And all of us have a responsibility to acknowledge it and address it so individuals and families can fully function and thrive like everyone else. The COVID-19 pandemic illuminated the systemic inequities that have generationally have been present. The social, environmental, and economic policies and systems we make have the greatest influence on our ability to thrive. We are all called to transform our social fabric for health equity. We are all called to this work. So our physical, mental, and social health and well-being are possible for everyone. This is why today I am pleased to join United Way of Dane County and the Health Community Solutions team in sharing our team's strategies to combat the public health crisis that racism has caused. And now I will pass it on to my amazing colleague, Dr. Renee Mo, to share with you on more.
Oh, thank you, Carla, for that introduction. By definition, a public health crisis is something that hurts and kills people. Or if to look at it in a different way, it impedes their ability to live a healthy and prosperous life. Let's just look at 2020 and the extraordinary year that it was. Data through June 2020 shows life expectancy at birth for the United States population fell from 2019 by a year to 77.8 years. This is the lowest since 2006. According to researchers at the Centers for Disease Control and Prevention's National Center for Health Statistics, life expectancy for Black populations declined the most from 2019 by 2.7 years to 72 years. Again, it's the lowest level since 2001. Latinx community members experienced the second biggest decline, falling 1.9 years since 2019 to a life expectancy of 79.9 years. Lower than when it was first recorded in 2006. The disparities highlighted in the study add to the mounting evidence of COVID-19's disproportionate effects on Black and Latinx members, health experts say. This is not new. This has been an issue of concern for a while, that we weren't making progress and we are sliding a little bit backwards. A study published in early February predicted that the pandemic will reduce the overall life expectancy by 1.13 years in 2020, with life expectancy for Black and Latinx populations 3 to 4 times lower than white Americans. In fact, according to the report, published in the peer-reviewed journal Proceedings of the National Academy of Science, COVID-19 was expected to reverse more than 10 years of progress in closing the Black-white gap. And let me say that again. COVID-19 was expected to reverse more than 10 years of progress in closing the Black-white gap and cut the life expectancy advantage of Latinos have over the racial groups and ethnicities by more than 70%. Make no mistake, the inequities and inequalities built systemically over many generations are what creates society's disparities. We know we can't go back to normal. In fact, ask any person of color, they do not want to go back to what the so-called normal was, because we know that normal was not working well. We can rebuild, we can transform, so we can rebuild so physical, mental, and social health and well-being are possible for everyone. Because what we want is a community where everyone can live up to their life expectancy and that everyone can thrive. And we know that that can happen. And we also know that transformation can happen within our community. And we are all here committed to that transformation. That's why we're holding this press conference today. Now with that, I will pass this on to my colleague and chair of the Health CST, Jessie Wang.
Thank you, Dr. Renee Mo. When the United Way Board of Directors tasked our Health Community Solutions team with recommending a new health mobilization plan and strategies that address the root causes of all aspects of health, we spent a good deal of time as a group dividing up the data or diving into the data and the health outcomes in our community. We tapped into sources that were already available, like the County Health Rankings Report, the Dane County Community Health Needs Assessment, various resources provided by the Public Health of Madison and Dane County, as well as much of United Way's own research and feedback from the community and agency partners. And we found significant disparities in the quality of care and the access of care between white community members and Black, Indigenous, Latinx, Southeast Asian, and people of color in Dane County. The data is clear and it's consistent. In fact, we could not find a single measure of health outcomes in Dane County that did not display a racial disparity of some kind. This evidence also showed us that our local racial disparities are not rooted in a lack of quality care or programs. We have high quality care. We have high quality programs. It is rather the lack of equitable access and culturally safe experiences. So with this in mind, we recommended 2 new strategies to the board back in April that were approved. The first is to reduce racial health disparities in Dane County. And the second is to expand resiliency and trauma supports to focus on the needs of BIPOC residents in Dane County. This shift in strategy focuses the United Way and encourages their partners more explicitly on the systemic issues resulting in poor health outcomes due to long-standing racial disparities in our community. Well, this kind of equity work isn't new to the United Way. I am so proud to see this renewed commitment across the organization and up through the board of directors to strategies that are specifically dedicated to fighting these inequities we have long seen as key influencers in health and healthcare. At this moment in time, we as a community have an obligation to address what is systemically impacting the health of our Black and Brown community members. The volunteer leaders in our health community solutions team should be commended for their dedication, persistence, and vision to tackle the tough and most critical challenges to achieving optimal health for all in our community. They work relentlessly to challenge our thinking, to push us on uncomfortable issues, and really drive meaningful change across Dane County through the United Way. They represent healthcare organizations, business, diverse communities and populations, and are the true drivers of this important work. I am energized by this commitment and encourage that together we will see real movement in the improvement of equity and the reduction of health disparities. Now I'll pass it off to Peng He, the CEO of the Hmong Institute.
Thank you, Jesse. I wanted to highlight what Jesse said about root causes of social determinants of health, and that they are not rooted in a lack of quality care or programs. We have some of the best healthcare centers here in Madison and Dane County. Social determinants of health are really rooted in the lack of equitable access and culturally safe experiences. Equitable access does not exist if you're a Cambodian elder and unable to explain where the pain is or what symptoms you have to your doctor because of the language barrier. Or if you're being made fun of, or call it voodoo, when a Hmong elder asks for a shaman who is a spiritual healer to come and perform a healing ceremony because they were chased by a dog, fell and broke their arm. The cast will mend the bone, the physical side, but you also need a shaman to come and mend the spirit from the trauma of being chased by a dog. Culturally competency refers to the ability to interact with people from across all cultures. Being culturally competent means you meet them where they're at. You recognize the lived experience, whether they are survivors of a genocide, the trauma from what happened to them or what they witnessed during a war, or racist microaggressions they face applying for a job. You honor and include their beliefs and culture in their treatment plan to enhance preventative care, reduce unconscious and conscious medical bias, and reduce variations in care access and quality of service to provide a culturally safe experience for the community. Research shows that organizations that are culturally competent have improved health outcomes, increased respect and mutual understanding from their patients and trust, and also increased participation from the community. So I applaud and thank United Way, their board, and the Health Community Solutions team with the intentional focus on equity and making cultural competency an institutional priority. We're creating a health mobilization plan that recognizes the lived experience, honors and includes a person's belief and culture into their treatment plan. And for making Dane County the best place to live, work, play, and now receive culturally competent health services. Next, I want to pass it off to my amazing and talented colleague, Karen Mendez-Collier, Executive Director at Central Hispano of Dane County.
Thanks so much, Peng. It's really wonderful to be here in community with all of you. I'm just reflecting on the fact that, this is my second mobilization plan that I've been invited to comment on for United Way. The last one was around education. And I just want to give a huge shout out to my leader, Renee, to Gabe Doyle, the community solution team members for really advocating and standing firm on moving in this direction. I am so proud that United Way has chosen this. And I have to say that I think of all the community solution teams that United Way has, the health team is really the most instrumental. In my 30 plus years in public health, I've come to understand that all the trauma that we face around income, education, basic needs, everything ends up affecting us when it comes to our well-being and our health. And so this is a tall task that this CST has taken. And as a community partner, what I want to say is that I will be committed to supporting their work because it's important. I was reflecting on the words that Carola mentioned, the quote by James Baldwin, but nothing can be changed until it is faced. I applaud United Way for continuing to face the issues in our community, to standing tall and saying that we are going to be a community where anti-racism is the norm. And I'm so proud of this direction. As we all know, social factors are predetermined by a life history. So when it comes to health and well-being, we also need to focus on how life history affects our path to education, to income and access to basic needs, because in the end, it's reflected in health. My life story is very different than others. And so it's important that if we're going to execute programs and initiatives in the community, they're grounded in the culturally relevant programming that we need. It is essential to make transformative change in this community. But I think one of the things that I've learned the most at Centro is that there's incredible value in focusing on culturally relevant programming in the community, because it really grounds solutions in the voice of community, building social capital, creating the resilience, coming up with innovative solutions that are really gonna stand the test of time. And right now, as we're trying to recover from COVID and everything that it has done for our families, our children, our neighbors, and our friends, we need to make sure that moving forward, we're really keeping equity and how central it is to health and well-being in mind. If we're going to get out of the impact of housing, going to get out of having a fantastic trajectory for our young people and our families, it's going to be essential. And so I'm here to say that I'm applauding this direction. I'm so excited, and I'm really, really rolling up my sleeves and committed to the work ahead. So thank you so much.
Thank you so much, Karen. And I just want to thank everybody who has participated and joined us today. My name is Gabe Doyle. I'm the Director of Community Impact with a focus on health, and have the privilege and the honor of working alongside the volunteers that make up the Health Community Solutions team, chaired by Jesse Wong, co-chaired by Shelley Shaw, who has joined with us today, and some of the most talented thought leaders and action-oriented individuals in our community. So we are thrilled and excited to be here today. I really want to give a big thank you to Karen. Your words are impactful, and I absolutely appreciate your willingness to roll up your sleeves and join us on this generational work. This is not going to be solved by one system, and this is not going to be solved in one lifetime. This is a community's work, and we all have the responsibility to roll up our sleeves. Peng, I appreciate your longstanding commitment to not only the Hmong community, but our community as a whole, and your willingness to roll up your sleeves as well. And I appreciate your thoughts about cultural competency and being able to really infuse culturally responsive and reflective care teams and practices within the healthcare environment that we know is so broad. Ms. Gaines, this work is your work. We say this at the Health Community Solutions team. Ms. Gaines is our North Star. I've known Ms. Gaines for my entire life since I was a little kid growing up in this community. So to be born as a mixed race, black, white little boy, adopted immediately by two white parents and having a black brother, there is no shortage of experiences that I've had that will illuminate and highlight the significant need for the comments that were shared today and the strategies and goals, audacious strategies and goals that our team has put forth today as the way that United Way of Dane County will invest in health and across the agenda for change moving forward. Dr. Corinda Renee Mo, my whole family has been a fan of yours, and so I am humbled to have you supporting the work, being a member of our Community Solutions team, and continuing to do so much for this community that many people oftentimes underlook or underappreciate. So my heart is extremely full today. I want to thank Renee Mo. It's not easy being a CEO and standing in the middle or the intersection of a shift in priorities. United Way has been tremendously successful for the past 100 years, and Renee is charged with making sure that United Way of Dane County is successful for the next 100 years. That's a big task, and I appreciate and I am grateful that she decided to show up, go arm in arm with us, and support and illuminate the vision of the Health Community Solutions team. We could have continued to share our vision for what we think may be a piece of the puzzle to improving the health and well-being of this community, but without organizational commitment, we know that that is just all that it would be, just conversation and visionary thinking. We really wanted to be actionable in our steps. I firmly believe that every Dane County resident should have what they need to live a healthy and safe life. The pandemic has proven that we can mobilize quickly to solve the biggest problems in our community. We are facing complex issues and we will need to address them individually in our communities and in our institutions. And we collectively have the knowledge, the resources, and the power to change our community and our state, and even in our county. So thank you all for joining us today. I'm going to pass it over to Ashley for the Q&A section. Again, we have the power, the wisdom and knowledge, and the collective responsibility to make Madison and Dane County the best possible place it can be, so that when we get those routinely ranked high marks for being the best place to be born and raised, educated, work, grow, play, and even retire, our Black, our Latinx, our Southeastern Asian, our Indigenous community members will understand where they fit in that equation, and these disparities will no longer be held as number one or number two or number three right here in Madison, Dane County, and the state of Wisconsin. But we will no longer have that title, and we will truly be the best place to be born and raise a family. And so it will take the power of many working for all, and we invite you to join us in this work as we move forward. Thanks.
Thank you, Gabe, and thank you all for your reflections today. I'm now going to open it up for questions. If you've not yet had the chance, please add any questions to the chat. We've got about 10-15 minutes. We'll do our best to answer as many questions as we can, but I'll just give everybody a minute here to go ahead and type in some questions. Okay, the first question, what sparked this need and for a change in the health mobilization plan strategy? So Gabe, I'll let you take that one.
Well, I think any of us could answer this one, so I'll just maybe lead off a little bit, and then I will invite a couple other folks to join in. What really led this spark is that you can look at any data set, whether it's the County Health Rankings Report, the Dane County Community Health Needs Assessment, and these are refreshed every 2 years, every 3 years. So it's relevant data. And many people have pointed this out, but there's not a measurable health outcome that doesn't show a disparity. And I think even equally important, it shows that the community members of those populations are raising their hands saying we need change. Our Health Community Solutions team could not take a step forward without acknowledging and addressing that concept right there. Again, we can all go and invest in programs and feel really good about them. But as Renee said, if we're not going after the root causes, we're not changing the dynamics within our community. United Way is built on being a transformational organization. And in order to continue to deliver transformational outcomes, we need to go to those root causes. And so our community solutions team felt very passionate that racism needed to be addressed. It was driving negative health outcomes for our Black, Latinx, Southeast Asian, Indigenous, and other marginalized communities to have negative health outcomes. And so what we really wanted to do was not say that we had all of the solutions, but to really understand that we needed to start investing today in that direction in order to start counteracting the negative impact that racism and oppressive stress has caused on many communities within our county. Jesse, Ms. Gaines, Dr. Renee Mo, Pang, Karen, I mean, Renee, we've all been in this, Shelley, we've all been in this space. So it's hard to triage that one because everybody is equally passionate about this direction. So if, you know, I'll lead off with Jesse as our chair of our group to welcome any thoughts, but also really recognize that anybody could share off on this one.
Thanks, Gabe. You know, as Gabe mentioned, we were ready to have a refresh. We had combined two of our community solutions team for some efficiency and kind of effectiveness across our work. And as we started looking across generations of what was really driving health of families in our communities, we had to go deeper, right? We've done a lot of tremendous work in health and have seen some really great outcomes. I mean, as I've worked my career in quality improvement across this state, and we've seen a lot of tremendous gains in things around aging populations, around prevention, and there's still work to be done there, right? There are still challenges we need to overcome. But when we looked at what was really driving the social determinants of health or health in our community, it was these disparities. It was racism. It was the fact that not all communities are treated equally. And so that is what drove this change, right? It was the need. It was United Way giving us the challenge to look at what was really driving health in our community. And I think we all knew what it was, but we're putting a stake in the ground to say that we are, as Karen said, rolling up our sleeves to start and continue the right work going forward.
Great.
I just want to thank you, Jesse. I just would also like to say that, and Shelley, if you want to speak on this, I would welcome you to this. Dr. Corinda Renee Mo and Ms. Gaines are juggernauts in our community. Let's not make any mistake about that or mince words. And I hold the responsibility to make sure that they feel comfortable sharing the messages as volunteers of the Community Solutions team, just like any of our other volunteers. And so the whole team, but I'll speak for myself, took it upon ourselves not only to have this responsibility as a United Way, but also a responsibility to our CST volunteers to make sure that their personal stories and experiences are no longer going to be just pushed aside. And so we really wanted to make sure that if we were going to chart a new course or make a strategic shift, that everybody on our team could also feel good about what we were saying. And so to ignore or not acknowledge the root causes of racism impacting health and well-being, I'm not sure everybody on our broad team of strategic leaders would feel comfortable going out into their communities and sharing our message. So no doubt about it, as mentioned before, we had some internal work to do, and we're doing it. We have a lot of external work to do, and I appreciate the folks on the CST willing to be a part of that journey. And this is going to take multiple generations with our community partners like Karen and Pang, who have so willingly showed up today to roll up their sleeves. So I just wanted to add in that component as well, which was there was a real desire by our health community solutions team to make sure that the messaging and the strategies were the right strategies. So the data showed it, and our team members expressed it as well. Ms. Gaines, are you about to jump in here?
I do. I just want to jump in really quick. I mentioned earlier before the next question comes in about trust. trust within our community is critical. And when your name, sometimes in our community, that's all you had was your name. And so your trust, integrity, your character, all those things are important. And for the health solutions team to recognize that within the community members to say, we've got to pivot, we've got to transform this. We now is the critical time. It's time now. And so United Way and the chair and the board, they said yes to seeing that need, and that allowed us to even be in a better position to move our own piece of trusting within the system. And so I'm going to stop there, and I don't know if anyone else wants to say anything, but I know we have another question, but I'm going to stop there.
Can I just say one thing? I think that the trust also started with United Way and other community organizations being on board with finally acknowledging the impact that racism has on the physical well-being of folks of color, right? And so that acknowledgement really goes a long way. I mean, you also have action that needs to accompany that acknowledgement, but that is where it began, is to acknowledge the problem and then to do something about it, right? So to me, that goes a long way in terms of building trust. And then we want to applaud United Way and other organizations for standing up, acknowledging that, and then being willing to do something about it.
Great, thank you all. We have a couple more questions in the chat, so I'm going to move on. Is there any money being dedicated to this initiative or a fundraising goal to support these new strategies?
Well, I'm going to start off on this one, but I'm going to pass it over to Renee. I mean, historically, we do have dedicated funding that goes across our different agenda for change areas. And I think no doubt about it, we are really asking this community, in the reflection of the ongoing pandemic transitioning into an endemic, and thinking about all of these different systems that came together to solve problems in real time, is there an opportunity for the power of many, thinking about the way that we solve problems at United Way by raising the community's dollars and getting them invested into programming that moves the needle amongst the Agenda for Change goals? We are welcoming folks into this space to be part of the solution. So we absolutely will have dedicated dollars to go to match these goals and these strategies to create that action that Dr. Renee Mo was just speaking about. Renee will do a better job of walking through that than I just did, but absolutely just wanted to acknowledge that we do have that.
Thanks, Gabe. I don't know that I'll do better, but I can explain that every year, the annual campaign raises the resources for the next year's nonprofit and United Way budgets. So the dollars we raise in 2021 will fund agencies that donors select next year, as well as these initiatives that the community asks us to curate. So you ask us to frame issues by the data, by the lived experience, to mobilize resources and giving and advocacy and volunteerism, and to be accountable for results. So we want to be transparent and proactive to let you know the work of these amazing volunteers and partners to really tee up the next framing of this particular health issue, which will then drive the decision-making that these volunteers will use to invest the dollars raised in this year's campaign. So the differentiation between direct giving that donors make to agencies and unrestricted giving that donors make to the greatest needs is what this is all about. So this framework allows all those dollars raised through greatest needs to be distributed to education, financial stability, and health. And each one of these Agenda for Change areas has a plan with these strategies that allow us to connect the dots between families and services across the community to get to larger outcomes. This is more than funding programs and agencies. This is really around systems-wide changes, and those dollars raised will be helpful. Last year, the Health CST space had $2.5 million. That includes our Health Connect program, as well as unrestricted dollars that go toward funding programs and agencies. And assuming the campaign will continue to be successful and there's great energy this year, we expect that that will be pretty similar to what the Health CST will have available for investment in these strategies.
Great. Thank you both. There's kind of a follow-up. I think that some of this may have been answered in these responses, but just wanting to know a little bit more if there is a specific program that we want to start with to move towards this goal of addressing racial disparities in health. And I know we talked about, you know, part of the investment decision process is how we're going to determine those things, but I don't know if there's a more specific answer to that.
The reality is racism isn't limited by an age range. It's not limited by 0 to 5 or seniors. It's not limited to Latinx community members or our Black community members. This is a big, complex problem that has been systemically embedded into our infrastructure for hundreds of years. So to say that we're going to magically wave our wand and solve it tomorrow by knowing the right sequence of programming is going to be challenging. We don't have that answer. There have been folks who have been in this space working extremely hard for generations, and there will be folks working in this space very hard and talented for generations. Hopefully not generations, but for at least another generation. What I'm really excited about the opportunity at United Way of Dane County, and specifically our Health Community Solutions team, is that our volunteers get to look at all of these different program proposals that come in, and they get to really think about the spirit of our mobilization plan and figure out what are the best programs that are going to move the needle into reducing or eliminating the racial health disparities. And make no mistake, the other area is to support from a trauma perspective, our Black, Indigenous, Latinx, Southeastern Asian, and other marginalized communities. If you think about 2020, and I know we highlighted this, and Dr. Renee Mo did a great job of highlighting this, there was no shortage of pain that went around, whether it be an economic pains, whether it be racial justice pains, whether it be health care pains. There was a lot of pain to go around. And when you add on to that, the experiences of our Black, Indigenous, Latinx, Southeastern Asian, and other marginalized communities, generational experiences, we need to heal as a community. We need to create spaces for people to be able to say, I'm not okay. And that's a little bit different than this big, bold claim of reducing racial health disparities. We just need to be able to wrap our arms around some folks at the end of the day and give them the therapeutic tools needed to be able to understand and move forward in a positive and a healthy way to dealing with racial trauma. So that's really a difficult task in itself as well. And I commend and applaud United Way and our Health Community Solutions team and our partners for showing up today to say, that's why I'm here. We need to be bold and go after the racial health disparities and end racism in our community. And we can do it. We have talented, smart, wealthy people in this community, resources in this community, educated people in this community, Black leadership in this community, Indigenous leadership, you know, Latin, I mean, you go across the board, we have the talent to solve this. So we look forward to welcoming in programs and looking for the best ones that are going to meet the need of our community members day to day.
Gabe, if I may just quickly add to that, I think the goal of the health CST is not to create new programming unless gaps are identified, but is to rise up the community programs that are already doing this impactful work and to align resources to further support them. So this isn't going to be solved, as Gabe said, with one program overnight in one population, right? This is going to be about listening to our community and then doing something about it, and really not necessarily United Way stepping in and trying to create new programs, but again, to rise up those community programs and maybe push a little bit on some of those community programs to make sure that we're looking at these, you know, with this lens. And so again, not one program, but really celebrating those community programs and aligning resources in the right way.
Yes. Well, thank you all. We are right at time, and I'm sure there's plenty of questions still to be had. I'm going to go ahead and put my contact information in the chat. That is also in all of the materials that were sent to our media partners who have attended today. So please don't hesitate to reach out if you'd like to learn more. We really appreciate you taking the time. All of our speakers today, thank you so much. our media partners and community partners that have joined us. We appreciate it. Again, please don't hesitate to reach out, and thank you all so much. You have a great day.